Well, kia ora, good afternoon everyone. Can I just thank all of those of you who accompanied me to Vietnam and say I trust the jet lag hasn't been too bad and you've recovered upon your return. Of course, the reason for visits like Vietnam is that we want to expand our exports. In doing so, we drive our economic growth, and as a result, we're able to invest in better public services like healthcare. Today, it's good to be joined by the Minister of Health, Simeon Brown. As most Kiwis understand, our healthcare system is facing some significant challenges, and it's important the context and the problem definition, I think, is well understood. To give you a feel for it, we already spend around $28 billion on health each and every year, and on top of that, the government has made a record $17 billion investment into Health New Zealand over 3 years. So I do want to be crystal clear that health spending is at record levels. We are spending more on health, and no government, in fact, has spent more in the history of New Zealand on healthcare. And while we have workforce challenges in some particular parts of the healthcare system, I think we've also made some good progress on the health workforce. A good example, would be nurses. In the last year, we have actually increased nursing staff by almost 2,000 nurses, or a 6% increase to 29,500 FTEs. Also, remuneration for nurses has improved dramatically and disproportionately compared to other Kiwis. Since 2014, average salaries for nursing and midwifery staff has increased by almost 70%. The average salary of a registered nurse is now currently around $127,000, including overtime and allowances, and that is on par with what nurses are paid in New South Wales, despite New South Wales being 30 to 35% wealthier than New Zealand. But despite all of that funding and despite all that workforce growth, we are not seeing the results that we have invested in. Productivity, as measured by the number of cases per employee, has declined almost 20% and has not kept pace with that increased funding and workforce growth. And that is totally unacceptable, because how it translates is that it means that Kiwis are finding it harder to get access to a GP, they wait longer in emergency departments and for first specialist appointments and for elective surgeries. Those wait times are all too long. And we don't want that, as our goal has to be about providing timely access to quality healthcare for all Kiwis. To be clear, we have the best doctors and nurses who do an absolutely amazing job helping their fellow Kiwis in need, and everyone who interacts with them will tell you of their positive experience. But it is the system that is letting them down and their patients down. A system dealing with botched health reforms, layers of bureaucracy, poor governance, management and financial controls, loss of regional and local decision making, outdated infrastructure and inefficient ways of working. What we need is a system that puts patients first and is relentlessly focused on lifting performance against the health targets that matter most to Kiwis. Quality and timely primary health care is the cornerstone of an effective and efficient healthcare system, and improving primary care access and choice for Kiwis is a top priority for this government. And that's why Simeon will be making an important speech later on this week on Friday about the healthcare plan in general, and we'll be making a series of announcements around improving primary care in New Zealand in the coming weeks and months. And with that, I'll now hand over to Simeon to make the first of those announcements.
Well, thank you, Prime Minister. I've been the Minister of Health now for 5 weeks and have had the privilege of being able to spend a significant amount of time visiting hospitals, doctor clinics and many other medical professionals around the country. I've also had the opportunity to meet with the most important people in our health system, the patients. We do have a healthcare system which is under significant pressure, but as the Prime Minister has also made clear, we're a government which has invested more than any other government in healthcare and will continue to do so, with the government investing almost $17 billion into Health New Zealand over 3 budgets. This Friday, I will be giving a keynote speech in Auckland to outline the direction that I'll be taking as Health Minister and the focus that I'll be bringing to the role. But today I want to talk about primary healthcare. One of my key focus areas as Minister of Health will be to ensure New Zealanders have better access to doctors and nurses in primary healthcare settings. All healthcare is local, and there is nothing more important than the family GP practice which serves over 50,000 New Zealanders on a daily basis, and who help to keep our communities healthy and, importantly, keep Kiwis out of hospital through prevention and management of patients in the community. Primary care is the cornerstone of our health system. When people can see a doctor or nurse quickly, we can prevent small issues from becoming major problems, and that benefits everyone. But right now, too many New Zealanders can't get the care they need when they need it, and that's why the government is taking action. I'll have much more to say about primary health care over the coming weeks, but today I'm pleased to announce a number of key commitments and announcements to support Kiwis to be able to see their doctors quicker and in a more timely manner. Firstly, Cabinet has agreed that we will fund and support 100 internationally trained doctors to be registered in New Zealand to work in primary care. Even though we need more doctors, we have overseas trained doctors living in New Zealand who want to work in primary care but can't because of barriers to registration and training. It doesn't make sense that these people are out there doing other jobs when we have a desperate need for doctors in our doctor clinics today, and we're fixing that. We'll fund a new 2-year primary care training program for up to 100 extra overseas trained doctors, ensuring they can join our primary care workforce as soon as possible. Secondly, we'll be funding more nurses into general practice. Under our plan, we will incentivise primary care to recruit up to 400 graduate nurses. This was about making sure that we can have more nurses in our primary care clinics, in our communities, and particularly in our rural communities. We'll be incentivising those primary care practices with payments of up to $15,000 in urban environments and up to $20,000 in rural environments to hire those nurses into primary practice. This will help attract essential healthcare staff where they're needed most, particularly in our rural communities. Thirdly, we'll be investing to establish a new digital healthcare service, giving New Zealanders access to 24/7 video consultations with New Zealand registered GPs and nurse practitioners. For some people, this will be game-changing. Digital 24/7 healthcare will mean access to a GP or nurse practitioner anywhere and any time, with the ability to have prescriptions issued and tests to be ordered, and this will be available for all New Zealanders. Health New Zealand expects to have the service up and running by the middle of this year, providing more access for Kiwis to healthcare professionals. Finally, today, I'm also announcing that Health New Zealand has agreed to deliver a $285 million performance-based uplift in funding over 3 years for general practice from the 1st of July 2025. This is made possible due to the government's record $16.68 billion investment in health and is in addition to the capitation uplift general practice receives on an annual basis. This will be an incentive payment for GPs to offer enhanced access for patients, including opening their books to new patients, achieving key government health targets such as increased immunisation rates, or supporting family doctors to undertake minor planned care services and to see patients in a timely manner. We know this additional funding will make a real difference in helping New Zealanders access their GP in their community. And I'll pass over to you, Prime Minister.
Thank you, Simeon. Look, these initiatives are just the first steps in our commitment to improving primary care and strengthening our healthcare system. This is about delivering real change for New Zealanders, not reports, not restructures, but actually results that matter, like access to a doctor when your kid falls ill at midnight. We will continue to build on today's announcement to ensure every New Zealander has timely access to quality healthcare that they deserve, and Simeon will have more announcements in the coming weeks ahead. Just before we go to some questions, the week ahead, this week Niue's Prime Minister Dalton Tangalangi will visit New Zealand. New Zealand deeply values its relationship with the government and people of Niue. I'm looking forward to catching up with the Prime Minister Tangalangi again after being with him in Niue last year on the 50th anniversary of Niue's self-government and free association with New Zealand, and having caught up with him a few times in Wellington and also previously Auckland. The Prime Minister will also meet with Minister Peters, Minister Collins and senior leaders from New Zealand's Ministry of Foreign Affairs and Trade and National Security agencies. And in House business, this week in the House we will consider further stages of the Sentencing Reform Amendment Bill and the Customer and Product Data Bill. On Thursday morning we will have all remaining stages of the Te Korowai or Wainui-a-Rua Claims Settlement Bill. And thank you, and with that happy to take any questions you may have.
On the doctors, so we're not going to see anything in the system for another 2 years?
Oh, well, they will be, so they've got to pass their exam, but they will immediately start their training in GP practices. And so that is a 2-year program. Normally doctors have to do the training in hospital settings. This will allow them to do their training in GP practices under supervision. And so they'll be able to immediately start serving New Zealanders in that setting. And as they train there, they're more likely to stay in those settings serving New Zealanders.
And on the virtual system, where is the staffing of that coming from? Is that pulling from the resource that's already understaffed in GP?
Well, look, ultimately this provides a 24/7 service for all New Zealanders. It'll be New Zealand trained GPs and nurse practitioners. Some of them will be, many of them will be from New Zealand. Some of them may be GPs registered in New Zealand but working offshore, able to support that service. Health New Zealand will go through a procurement process to procure those providers for that. Look, we have invested significantly in our workforce, and we will continue to do so. We've increased the number of doctors being trained on an annual basis by 75 placements every year in our universities, and we'll continue to invest in making sure we've got the doctors and nurses New Zealanders need.
But is it going to drain resource out of the general GP system, which is already under strain? You already can't get an appointment.
I think this is it's about providing another option for Kiwis, and that's why today's announcement is about saying, look, there's 100 doctors. We're going to train them to work in GP practices. Currently, some of these people are, we hear the stories driving Ubers when they should be actually practicing medicine, which is what they've been trained to do, but they've trained in a different country. So this announcement today is about more doctors and nurses in GP practices, plus it's about providing another option that New Zealanders will have to be able to access those important services in the way that works for them. You talk about the record funding and health. You may have seen the survey from the PSA today, where the overwhelming response from health workers was that the frontline is suffering and that the Bank was cut off 13 frontline services. Well, look, that's from the PSA union, led by a failed Labour Party candidate who couldn't even win her safe Labour Party seat. Come on. Ultimately, we have invested record investment in frontline services. There's 6,500 more frontline staff working in Health New Zealand over the last 2 years. There's over 2,000 more nurses. We have invested significantly in frontline services, and we will continue to do so. And that's where we want the investment, not in the bureaucracy. And the Public Service Association represents the bureaucracy. So I accept that they are doing what unions do, but they are led by a failed Labour Party candidate who is simply just trying to oppose what this government is trying to do to make healthcare more accessible for Kiwis. It's the union, right? It's their members, it's their workers. 4 out of 5. Look, and I think they had about 1,000 responses from there's like 90,000 people work for Health New Zealand. It's a very small number of people in a self-selected survey. So all I'd say is that there's the PSA union doing what the PSA union does. We're here talking about the good things this government is doing, investing in healthcare, hiring more doctors and nurses, focusing on frontline service delivery. That's what matters to Kiwis, and that's what I'm focused on.
And I think, can I just add, Craig, the key thing is that we want to get rid of the bureaucracy, and we have to. We are tipping more money in than we've ever tipped in before. We have more, workforce growing and more workforce going in the frontline parts of our system, and yet we're getting poor results. And so we need those results to be stepped up. And the reality is, we know we've got a low-performing organisation, and we need to turn it around. And sorry. No. You go back to 2014 and look at our results today on emergency wait times, first access to specialist appointments, elective surgeries, cancer treatment times. All of that has gone backwards over the last 6-7 years. And what we've got to do is say, look, we've got enough money going in. When you've actually hired 2,000 more nurses, when their salaries now are on average at $127,000, and it's on par with the equivalent folk in New South Wales, we have made a huge investment. But when you see case weights per employee tracking down by almost 20%, that says to me that we've got a massive system and organisational problem. Now, this is a large organisation. It's got up to 95,000 employees in it. It's a complex system, I get it, but it's not just a money issue. It is actually, we have to ask the question, if you want better health outcomes and you want to be patient first and focused, which we do want to do so, then you've actually got to say, these are clearly what we're shooting for as targets. Now let's organise around making sure we deliver for those targets. There's enough money, there's more resources going in, and there's more workforce growing well.
How do GPs access the $285 million if it's separate to the capitation payment?
So Health New Zealand's going to work with GPs around that, but ultimately they fund they provide an annual uplift every year. This will be part of that, but it'll be about them meeting certain criteria. So making sure they've got their open books, making sure that people can be seen in a timely manner. It's about making sure that as we increase funding, which is really important for our GPs, they're also making sure they're providing that access that New Zealanders need.
Isn't capitation a way of incentive of ensuring that GPs do keep their books open so they receive extra capitation per patient?
Well, that is part of it. I think there's a Health New Zealand is looking at the capitation model to make sure that it is fit for purpose. It hasn't been looked at properly since 2002, but this is actually saying, look, a third of GP books are currently closed. We want to encourage those GP clinics to open their books. There will be increased funding available for those GP clinics who have their books open, who are able to provide that access to those services in a timely manner for Kiwis.
If the capitation, $1,000 thousands of dollars for additional patients is not enough incentive to keep GPs.
Well, it's not thousands of dollars.
But if you take on additional, it can be up to, I think, $500 a patient. So you take on, for each patient it is thousands.
It depends, yes.
Yeah. So if that isn't enough to incentivise GPs to keep their books open, then how's this additional money going to do it?
Well, ultimately, we're putting more money into general practice. Health New Zealand's putting more money into general practice to encourage doctors to be more accessible to their patients. And that will mean they'll be able to hire more staff, they'll be able to invest in more resource, to be able to provide more access for the patients who are on their books, as well as to be open to...
For additional patients, isn't the case the money really isn't the issue, it's the staffing?
No, it's both. I mean, ultimately they need more funding, and also what we're doing here today is providing more staffing, a resource as well, by saying 400 nurses being funded to be able to do their training and start their careers in general practice. And we know that if they start there, they're more likely to stay there, which is fantastic outcomes for Kiwis.
And I think sorry, we'll just go over here, sorry.
Can you explain how the 24/7 digital service will be different to what we have in Helpline?
Yeah.
Well,
Better resource?
yeah, it'll be better resource. These will be doctors and nurse practitioners. They'll be able to prescribe. They'll be able to refer you for tests, for other things as well. So these will be not just providing advice, but that'll be just like going to a doctor and having an appointment. So that's going to be the benefit of the 24/7 service. It'll be available for all New Zealanders to be able to access and provide more choices.
And can I just say, I think that is a really exciting development, because when you look at our healthcare system, you think about the modes of care and delivery, actually leveraging the technology that we know is sitting there with massive innovation that can actually disrupt the system, that actually means that you can talk to, say, a nurse practitioner who can actually prescribe medicine for you at 11:30 on a Friday night, when you know what you need to get sorted, is actually really good. That's what we've got to be doing to make sure we deliver the goal, which is timely, quality access to primary care. So I think there's a lot of disruption that's actually, by starting up this way, you could see this taking off quite well in the coming years ahead. Sorry?
In terms of accessibility, though, do you think there might be people that have access to a phone but not to the internet?
Yeah, look, it'll be a digital service, but I mean that's providing more choices. That's ultimately what we're doing here, is providing more choices for Kiwis to be able to access primary health care, and that's a really important thing, 24/7 round the clock. So that's about providing peace of mind to many New Zealanders as well.
And sorry, I think also...
There's no point in being able to get a prescription at 1 a.m. if the pharmacy is not open at 1 a.m.
Well, look, I mean, this is the thing which people also go to work during the day, and so being able to access healthcare at a time that works for them means they're able to do that.
Prescription if there's no pharmacy open?
Well, ultimately, that's when they can. I mean, if you think about the choices, this is providing people choices. Doctor clinics aren't open all the time, pharmacies aren't open all the time, but it's about providing more choices as to when you can access that primary health care, time which works for people. And people live different lives than just simply a 9 a.m. to 5 p.m. So it's about actually providing more access and more choice for Kiwis and meeting the needs that they have.
And also, if that means an appointment that is having to be scheduled in a 9 to 5 with a normal GP is done outside of those hours and processed in a different way, it's a slot that's not taken up, that's taking people 1 or 2 weeks before they can actually get into their GP. So again, we've got to think about how we can actually deal with a number of appointments that actually comes off the load of GP practices right now that clogs up, and you end up waiting 2 weeks, at worst case for an appointment. If you can access that quicker, get relief quicker, that's all good. Sorry, yes,
A couple of questions. First of all, will there be like a priority system? Because obviously some people are more likely to have to afford going to be GP than others. How will you triage that free service?
Oh, well, sorry, it's not a free service, so it will be a user pays service, similar to going and seeing your GP. Obviously, if you've got a concession, a community services card, or you're under 14, all of those same concessions will apply. More detail will be announced close to the middle of this year when it is launched in regards to that. But again, it's about providing more choice for New Zealanders to be able to access primary health care.
And just with the incentives for the doctors to take on the nurses, is there a stipulation they have to pass on some of that money to the nurses to recruit them?
No, that's about making sure that it's about supporting them as they recruit graduate nurses. So it's about supporting the GP. No, it's about supporting the business and the GP clinic to be able to take on those nurses. They obviously have to. There's training, there's supervision required as they graduate. So supporting them into transition into primary health care. It's up to the business, up to the GP clinic as to what they do with that. But ultimately, it's about saying to them in urban environments, $15,000, and in a higher payment in rural communities where we know how more challenging accessing GPs can be in rural communities. So it's been encouraging and incentivising that for our GP practices.
Move to those rural areas,
Yep.
needing money to incentivise them to move there?
It could well be used.
Well, I mean, that's ultimately up to the GP clinic as to how they use those funds.
Just to clarify, Minister, this 285 million over 3 years, that's different from the broader review of the capitation
Yes,
model.
yes.
And on the 20% productivity, how much of that do you attribute to just the increasing complexity of cases that are showing up? You talk to GPs, you talk to people
Well, that's
anywhere in the house, the issues people have are more complex.
sure. That's a measure of our hospital performance. So that's looking at our case weight across the hospital system and looking at what's happened over the last 10 years. And it's effectively said, look, we're putting more resource and more people in, but we're not seeing the same amount done. And so, look, there's a range of factors behind that. But ultimately, Kiwis are waiting too long to get service and get access. And for the last few years, since Labor decided to restructure the health system in the middle of a pandemic, the system's been focused on structure rather than on delivery of services to patients. And so that's what we're getting it back to. And we expect all parts to be focused on serving the patient, putting patients first, delivering against those health targets. I think last year there was around Health New Zealand did deliver around 10,000 more surgeries than the year before, which was great. We have to go further because we need to get on top of those wait lists.
Prime Minister, can I ask, did you watch the Oval Office meeting with President Trump and President Zelensky?
Yes, I did. Sorry?
What did you think?
It was a pretty tough watch. It was definitely a tough watch. Both parties have said they could have handled it or gone better. The bottom line is very simple for us. Nothing's changed in our position and support for Ukraine. Ukraine's doing and President Zelensky's doing an exceptionally good job as a wartime leader, as a leader of a small country that was invaded by a bigger country, and we stand with Ukraine. And so we continue to, with our defence forces, train Ukrainian soldiers in partnership with our UK friends in the UK. We've, as you saw on the 3rd year anniversary, had another $3 million into the Ukraine Relief Fund. And importantly, we've increased and cranked up the sanctions even more against Russia. So, the reality is we want the US and Ukraine working through a proper peace plan. But yeah, it was tough watching.
Do you think that President Trump, or does it worry you that President Trump is aligning more closely with Russia?
Well, again, what we want is a just and lasting peace. And for that to happen, we need the US and Ukraine and Europe to be involved in actually developing that peace plan. And that's what we all want to see. But again, we are a country of values, and we stand up for nation sovereign states. We stand up for freedom of navigation. We stand up for the rules-based system. And that's what Ukraine has done well. Just remember, it was Russia that invaded the Ukraine, and they were the aggressor, and Ukraine was the victim of that. And so we stand with them.
Was President Zelensky treated poorly?
Sorry, Jen, I'll come back.
Was President Zelensky treated poorly by the United States?
Well, again, as I said, it was a tough watch. Both parties have said they could have gone better.
Do you think that the United States is a reliable partner going forward?
Yes.
Do you think that the United States also shares our values around a rules-based nationalism?
Yes, but as I've said globally, and I've said for some time over the last year, I continue to advocate for the rules-based system because I think, in many ways, our world order is breaking down from rules to power. That is one of the things that we've got to guard against. And so we've got to continue to make the case. We have an independent foreign policy. I, as Prime Minister, act in New Zealand's national interests. And yes, there's no doubt about it. It's a more difficult geopolitical environment out there in the world, as you've seen in events over the last few weeks. But for us, we have a strong partnership with the US. There's lots of collaboration and there's lots of things that we can do together.
The Greens want you to rule out any involvement in August post that meeting. They say he's just too unreliable to do any sort of partnership with. What was your response?
Well, no disrespect, I don't take foreign policy advice from the Greens, but what I would say is that there's nothing that's changed in our AUKUS position. We continue to explore whether that's in New Zealand's national interest, and we'll continue to do so. Audrey.
Yeah, you said a couple of weeks ago you'd be open to an invitation for troops, a peacekeeping force. Is that still your position, and have you been sounded out?
No, I mean, I haven't been sounded out, but yes, it is still my position. I'd be very open for New Zealand participating in a peacekeeping mission, but obviously we need to have a peace secured first and foremost, and it seems like we're a wee way away from that. So that's why I want to encourage all the parties to develop that peace plan. That means that Ukraine has to be at the table as part of that conversation, and there'll be ultimate choices for Ukraine, but we need to be able to support them. And if there was we'd be very open to considering a peacekeeping mission. As we do, we have fantastic. Our troops are well respected and participate they're still in very difficult parts of the world doing peacekeeping missions as we speak. Sorry.
Prime Minister, what's your response to China informing Australia that it can expect more warships following the live fire?
Well, I mean, as we've seen, they're acting completely within international law, and that's important. Our issue was around the live firing rounds, which were, we felt, good practice would have been 24 to 48 hours advance notice, and potentially not doing it in the middle of a trans-Tasman air route. But, they're completely within the confines of international law, the UN Convention of the Law of the Sea. Those are the same laws that we rely upon with the freedom of navigation that we expect when we move around the world as well. So, that's their decision as to why they're doing it, as to where they were going. We're not informed in advance of that. But as I've said, no doubt about it, a much more contested world and, certainly not a benign environment.
Has anyone approached Chinese officials following the live fire drills?
We, Sunday week ago, raised the concerns with the Chinese at an official level, and I know it was raised in Minister Peter's meetings in China as well. Sorry, I'll just come to...
Prime Minister this morning, Mr. Keir Starmer, spoke of a coalition of the willing that would, back Ukraine maybe more strongly than it's received from some allies recently. Would you imagine New Zealand being part of that coalition?
Well, I think you have seen us, back Ukraine. I mean, we've announced that, as I said, more funding as we've been putting into the Ukraine Relief Fund. We're very comfortable with our troops continuing to work with the British troops to train Ukrainian soldiers and extending that. We're certainly, been cranking up sanctions against Russian interests as well, and we'll continue to do so. So, I can't be any clearer. Our values are with Ukraine and with the Ukrainian people and with President Zelensky.
Would you consider us as joining into that coalition?
It's not a discussion that we've had at this point. I appreciate we're a long way away and our resources are somewhat small. But more importantly for me, it's about a principles and a values thing, is that if you've got principles and values that you talk about, you've actually got to back it up. And that's what you've seen us do. And I spoke about this strongly in opposition at the time when the war started. It's an illegal war. The quickest way to stop it is actually for Russia to stop it. And we continue to entertain, and I've spoken with President Zelensky several times and met with him at least once in a very comprehensive way. We'll continue to, if there's anything else that's needed, we'll continue to consider it. Sorry, Jamie.
It seems like every single day we're seeing a news story about the school lunches program. When do you go to step in and force David Seymour to fix it?
Well, I mean, David Seymour's spoken with me and given me an update of the issues that he's facing, but I've got every confidence that as a senior capable minister, he'll be able to sort it out.
Have you put any deadline on that? Because you previously asked him to make changes to it, and it just seems to continue issues.
I haven't put a deadline on it, but I know he's taking it very seriously. It's got his full attention, and he's working through the issues, day by day. So, I mean, I expect him to sort it out and solve it, and I know he will.
Have you been disappointed by those issues?
Well, I mean, I think the reality is, there's some pretty frustrating experiences. There's some very good experiences, to be honest, as well, and they probably don't get reported upon. But again, David is all over it. He understands what's required. He's in the detail of it all, and he's working the issue. And so, I've every confidence David will get it sorted.
Prime Minister, there was a scaling report released today on the governance of Wellington Water, and found that Wellingtonians are paying 3 times, in some cases, the amount for new pipes than other parts of the country. Key big New Zealand firms embedded in the provision of that, that they were providing much more cheaply in other parts of the country than in Wellington. How widespread is this? And how much of a concern is this for a government that's keen on local infrastructure, water done well, and potentially local government?
No, it's a good question. I mean, the bottom line is I haven't seen all the details, but the details I've seen is unacceptable. Wellington Water is a total basket case. It has been for some time. It's not a proper CCO like we see in other parts of the country. It's a rather unique corruption that's been built up over a number of years. And the reality is that they need to professionalise the management of the water assets here in this region. And it's not people call it a CCO. It's not a proper CCO that has balance sheet separation, proper governance, proper management. It's sort of at the whim of how much each of the different mayors can throw into the kitty, and that is not a way to manage long-term water assets. And that's why they need to adopt the local water done well models that we have presented and that Simeon presented as local government minister and Simon Watts is advocating strongly for now, and get a proper structure in place.
Were you ever advised of these issues when you were local government minister?
I think everyone's been aware of the issues with Wellington Water for some time. I think Georgina Campbell writes about it on almost a daily basis.
Sorry, what about Wellington Water is corrupt? You said corruption.
No, as a configuration of like the way that it's organised as an organisation. Sorry, the way that it's organised is not how our water assets are managed in CCO structures around outside of Wellington. So it's often, I notice here in the bubble of Wellington. No, I mean as a configuration of an organisation, it is clear that it's not the same. It is not configured on the same basis that we would have CCOs configured in other parts of the country. You good folk here in Wellington often refer to it as a CCO. I don't think of it in those terms. I don't think of it as properly structured, and as a result, it's a total basket case.
At face value, it does appear that some of the large firms involved in this have been charging Wellington more than what they're charging in other parts.
Yeah, well, that's
How concerning is that to you?
Well, it's very concerning because that's the bits that I have read. That is what is worrying about this, is that what is actually going on with respect to what people are being charged and what is fair and what is happening. So.
There's only a handful of big players in New Zealand. I mean, does this warrant some sort of central government public inquiry?
What it warrants is for Wellington to focus seriously on improving its water assets. For that to happen, it needs to adopt one of the many models that have been positioned around local water done well, put a proper governance structure in place, get proper balance sheet separation, make sure long-run assets are properly debt funded, and actually have proper management controls around the spending and the asset management that needs to take place.
You have an observer in there now.
In the council?
In the council.
Yes. Yep.
One of the budget. But I mean, based on what you've seen in the report, what will you be expecting as central government to see come out of that?
Well,
what actions might you take if you're not satisfied?
Yeah, well, I mean, the key action I want to see is I want Wellington to move to a proper organisation that actually deals with the management of its water assets. And we've seen some good models of that, whether it's been the water care model, which I appreciate was a unique vehicle for Auckland. But when you saw an Auckland Council proposing 26% increase in rates and it ending up with 7% increase in rates because of the way it did the balance sheet separation and the funding and financing of those water assets, which is exactly strategic and long-term and exactly what professional modern countries should be doing, rather than what you see here is everything's just loaded up onto a ratepayer as a result. So, the reality is we've got major challenges, as we've seen with the performance of the council. We've got challenges here with Wellington Water. We can be so much better, and we must be so much better than this. The local water done well models is what we need applied quickly into Wellington, and I expect that's something the local government minister will be focusing on.
Can you compel them to do that? Do you have any way to compel them to take up on those models?
Yeah, we've got a series of options that Simeon can talk to from his previous experience in local government, where we basically went to the ratings agencies, and rather than spending $1.2 billion like the last Labor government did and got nowhere, we went and spent an insignificant, a relatively small amount of money to get clarity on which models would actually drive and create balance sheet separation, so they could borrow assets, borrow proper long-term debt funding for long-run assets. So the models are all there, but what we're seeing today is just is not professional, not gripped up, and it's lacking in proper management controls and governance controls.
Does it remain the government's commitment to lower the age for breakout training?
Sorry?
Does it remain the government's commitment to lower the age for breakout?
Yes, we know it's difficult, we know it's challenging, but we continue to consider that, and we've got a number of announcements in the healthcare space, as I foreshadowed, in the coming months ahead, and I'm sure that's something that Simeon and his team will duly consider.
Can patients expect action on that this
Yes, I think they can.
In the budget, will it be covered in the budget?
Sorry, I'm not going to get into it. You'll just have to wait till the budget. Sorry?
What's been the hold-up?
There's been no hold-up. We're just we're working at pace to deal with the challenges that we've got in our healthcare system. And right here, right now, when you just tip an extra $17 billion in, when you hire 2,000 more nurses and your productivity continues to slide, we have a major organisational problem that needs to step up. And that's why we've made the changes we have around the commissioner initially. That's why we've made, that's why we need, management structure and team in place that actually can deliver the results that we want to see for better patient outcomes. Sorry, I'll just.
Patients can rest assured you will keep that commitment.
What's that?
Patients can rest assured you will keep that commitment to lower the age of bowel screening.
We want to work on lowering the age of bowel screening, yes, but we'll have. Well, just hang fire. I've said to you we've got a range of healthcare announcements, but we are sequencing and working our way through the most pressing issues. And right now, when you have wait list times in emergency departments because actually the primary care system's failing, and as a result people go straight through and clog up hospitals and emergency departments, that's not cool. That's the issue we've got to try and focus on and solve. It's a big problem. It is, for sure, but also actually having access to a GP and actually having access to primary care so that you don't actually end up going into an emergency department because you've actually been dealt with in the primary care system is also very important. So it's a complex system, but we have to work our way through it because the money's in, the workforce is growing, and the remuneration of the workforce is growing, but the productivity is poor, and that says we've got an organisational problem which we need to sort out and get fixed. Okay, sorry. Yes. Sorry?
What can we expect from the discussions? What's going to be discussed?
Look, it's just we actually meet more regularly as he passes through Auckland. I have to meet with him in Auckland. It's really just a chance for us to touch base, check in, see how everyone is, what's going on with each other, share what's happening in our respective countries, and it's just a courtesy call. And so it'll be very informal, very friendly, and it's a chance for him and I just to catch up and talk about a range of issues in the Pacific and across the region. Sorry? So I'll come back to you, Glenn. Yeah.
Have you made a decision yet on whether the Electoral Commission needed an review or an inquiry following the Madai stats?
Yeah, I know Paul Goldsmith's looking into that right now, and he'll have more to say about that shortly. Glenn? Sorry?
Helen Clarker's question our involvement with the Five Eyes, given concerns about the Oval Office, about Donald Trump's views aligning with Russia. Do you think New Zealand should remain part of that?
Absolutely. It's in New Zealand's national interest to remain part of it. And I'd just say to you, as Prime Minister, I see our current intelligence reports, not ones from 20 years ago. And I'd just say to you that it is right that we are very much part of the Five Eyes network.
You hit at the Green Party, but do you think New Zealanders are justified in being concerned about our alliance with the US at the moment?
Well, as I say, New Zealanders should know that we have an independent foreign policy, a government and a Prime Minister that will act in their national interests and New Zealand's national interests. And we understand if we drive more prosperity and security, those two issues are linked. And there's a range of considerations that we make, as you've seen around supporting Ukraine, as being part of the Five Eyes network, and other five-power defence force arrangements that we have in Southeast Asia, for example. So, we will continue to act in New Zealand's national interest. And it's no longer a benign environment, as I said. So it might have been 20 years ago, but it's not today. And so we are taking the right course of actions, and we get tremendous value from being, in the intelligence sense, from being part of the Five Eyes network.
You said before that you still consider the US a reliable actor in this space. How do you
In what space, sorry?
You said before, Jamie asked you whether we can rely on the United States to give its word.
Yes.
How do you justify that after what we saw on the weekend?
Well, as I said, what we saw was a tough conversation and an uncomfortable one. But
basically a 180 on their entire position.
Well, but I'll just say to you, we have to find a peace in Ukraine, and Ukraine working with the US and Europe is really important. And I think you've seen a huge effort from leaders all around the world actually working towards that. You've seen that particularly from the European leaders. But for a peace to happen, we've got to have Ukraine at the table and US involved as well.
Do you trust Donald Trump?
Yes, I do. I trust the president, and I trust the American system, and that we can work well with the American system. I will continue to act in our own national interests, as you would expect me to do. But I think we can work well with a number of leaders and partners around the world.
Helen Clark was talking about the mission creep of the Five Eyes. Are you comfortable with how broad the mission of the Five Eyes has become, or could you see a scenario in which New Zealand could group together with other countries within the Five Eyes, especially say Canada, or something like
Well, we have, there's a lot of hypotheticals in that question, and I'd just say to you that, I think there is a recency issue in terms of, I am seeing our intelligence reports here and now versus, as I said, with all respect, 20 years ago. And, the intelligence network that we have is a really important one. It actually is in New Zealand's national interest to be part of that, and we benefit from being part of that. Equally, we benefit from being a five-power defence force arrangements in Southeast Asia. We benefit from a whole range of other arrangements that we have with bipartisan arrangements between different countries, as well as obviously in collectives as well. The IP4 is another example of that. So, there's a range of things that we do to act in New Zealand's national interests, and we'll continue to do so, and that's one of them. Okay.
Just back to valve screening, the national
Yep.
policy was to commission a business case. Has the business case even been started?
Again, we'll have more to say about a number of health issues as we go through the next few weeks and months. Yep, we'll have more to say about it. And honest, Thomas, when we're ready to talk about it, we'll talk about it, and you'll know about it then. Sorry. Again, we'll have more to say about it, and when we do, you'll be the first to know.
Which
Awesome.
of them stands, the one that's in that policy document or the one that you made in the News Hub leaders debate to lower the age?
Again, we'll talk about that when we're ready to talk about it. Thank you so much.
Thank you.
Appreciate it.